Good afternoon, everyone. My name is Gary Williams. I am the founder of PatQ. As stated in the PatQ business description, we aspire to be a bridge between primary and whole person-centered care. What exactly does whole person-centered care mean? That means ensuring that not only can the patient receive an ice pack and Band-Aid for their medical need, but we're also making sure that we supply the resources that help support their social environmental needs. And one of the examples that I generally lend to is through a TEDx speech that I gave in 2019, where I used an example of a member of ours when I worked for United Healthcare, who was a frequent flyer in the emergency room. And after really discussing this with the personnel attributed to that medical center, they couldn't figure out why she utilized the emergency room as much as she did. And it was only by a chance occurrence of meeting her was where I was able to really identify and figure out what her issues were. And part of that was her living environment. She lived in an environment that was bed bug ridden. She lived in a building on the third floor that did not have a working elevator. And granted, she had an oxygen tank that she would drag everywhere that she went, meaning that whenever she had to leave and leave her apartment or go home to her apartment, she had to carry that tank up 3 flights of stairs. And given her age and her fragility, I could imagine that that was difficult for her and would eventually cause some type of health issue for her, lending itself to her overutilizing emergency room services. And by really identifying that through a chance occurrence, we were able to connect her to local community-based organizations that were able to help her with her housing situation, as well as her access to transportation issues. So that was something that sparked the idea of PatQ. It helped me really push to understand why individuals consume healthcare the way that they do, through a term called psychographics, but also identifying the where and the how behind closing those social and environmental gaps, which are now known as social determinants of health. So given where we are in this healthcare space, given my experience from a payer standpoint, working with United Healthcare, using the example I just used, to my experience within ambulatory health, working for 2 FQHCs, and namely the current one I work for in Central New Jersey, where I serve as the Chief Quality and Practice Operations Officer. I have an outreach team that is responsible for building an ecosystem, connectivity between our organization and community-based organizations to make sure that not only the healthcare needs, but also the social and environmental needs of our patients are met. We've done things such as create a satellite site for women, infant, children within our facility, which co-works with our pediatrics department and obstetrics and gynecology department, which has bode very well for us as an organization, from not only impacting the patients that we currently serve, but also attracting individuals from the community who may not have been aware that these services were available, not only from a medical space, but also from, again, a social services space. So that's one prime example of what I've done throughout my career that really prepared me to take on this role as the founder of PatQ, which again is an artificial intelligence platform where we facilitate surveys with our patient and or member population. And the objective is to identify the issues that this person or this man, woman, or child may have, and then connect them to the appropriate resource within their locality by using artificial intelligence to identify the location and the contact information for these particular locations. Because again, access to care is something that currently exists, and it drastically decreases the life expectancy of individuals within our community, especially within the BIPOC community, individuals who may suffer from chronic disease issues and may not be aware of resources available to help them manage their disease or just manage their life situation overall. Because something that is not really talked about generally, most of our healthcare issues are environmental and socially based. So if I am someone who deals with hypertension and I live in a food desert, there's a good chance that I'm going to continue to have hypertension because all I have access to is a local bodega who has salty snacks, salty meats, chicken, things of that nature. And by them connecting with a social worker or a user of this particular platform, we'll be able to identify resources in the community, such as a local food bank, other local charities that may be able to provide some type of sustenance to help support that man, woman, or child or family and in terms of managing their healthcare needs, their overall health needs. So that's just a brief example of what I've done in terms of my career. Again, 8 years of healthcare administrative experience, from being a senior clinical transformation consultant to now a chief quality and practice operations officer. I've seen it from both sides of the coin. I've grown up with individuals who are dealing with chronic illnesses, family members as well, and I understand all too well how debilitating it can be for someone who feels as though they don't have access to particular supports in the community. And I want to be able to give social service organizations the tools that they need to help individuals identify the where, and then we'll deal with the what and how. Again, my name is Gary Williams, founder of PatQ, and I look forward to any further questions that you may have about my product, about my business, and how I aim to impact the community that I intend on serving. Thank you.